Interventions for mental health disorders and for dual diagnosis are similar in theory with drug and alcohol interventions. A lot of families that come to our website, they'll see so many references to addiction. They'll actually say that they don't think we're qualified or we're in a position to help because their loved one has a mental illness. And the reality is, in the 2 decades we've been doing this, I can't remember the last time a substance user did not have an underlying, or at least didn't present with, underlying mental health disorder symptoms, or there wasn't a dual diagnosis going on at the time of the call to our office. So families often want to believe that it is a mental health disorder that is the primary problem, which very well may be the case. But the truth of the matter is, when it comes to treating any type of mental disorder, and if there is any chance of substances being used, even at minimal levels, the clinicians, the interventionists, the family, etc., should always remember that it is protocol to assume that the symptoms or the behaviors are a result of the substance use and not the mental disorder until proven otherwise. So many different things can exacerbate mental disorder symptoms. Even when people are diagnosed early on, which a lot of people are, it also doesn't mean that the diagnosis is accurate. There's a lot of people that are diagnosed with mental disorders in times of crisis, during substance use early on, and they're done so primarily by family doctors, and they're done in 30-minute office visits. The proper way to rule out any and all causes of mental disorders other than a true mental disorder is to stabilize a patient over the course of several weeks, observe them, and have an integrated treatment team do so while they bring the person to what is called a baseline, which means all else is ruled out and we're treating the actual person and their symptoms influenced by nothing other than the mental disorder. So mental health interventions are about us coming out, helping the family and their loved one with whatever they may be suffering from, and help them safely arrive to a place where a team can determine what it is that's going on. No interventionist, and even a clinician or a psychiatrist, can possibly make an accurate diagnosis, even with the history of those diagnoses, in the time of an intervention or in the time of the crisis. So when you break it all down, the best way to go about the mental health intervention is to put the person in a facility where the team can observe everything and anything so that they can make the best possible determination as to what's really going on.